Are we ready? All
Yeah,
right.
actually, yeah, I'm ready, yeah.
All right. All right, this is September 7th at 9 a.m. 2021. We are starting the Health Committee meeting. Would you take roll, please?
Bard,
Yes.
Curtis.
Yes.
Zumwalt,
Yes.
Awful.
Yes. You may have a motion to approve the minutes. Roger Bauer. Second, and it's resume alt. And all in favor?
Aye.
Opposed? Motion carried. Has everyone read the claims? All right, may I have a motion to approve? Mr. Zumal, second. Arnie, and,
Bard,
Yes.
Curtis,
Yes.
Zumwalt,
Yes.
Awful.
yes. Do we have any public comments today? Okay, none. And then we have animal control, and Chairman John is going to speak on that.
As everybody, I believe, knows that Dr. Youssef has resigned and left us in kind of a pickle, to say the least. And we've been trying to get things straightened out. I made a few comments last month about the situation. And there's a couple things in those comments I found out that may not be exactly correct. Nevertheless, well, what we're kind of left with, I believe, is three options as far as how we can go ahead and proceed. One option is to purchase the facilities that Dr. Youssef has in town here. Another option would be if we could find a place that we can use temporarily, probably a building that might be about 900,000 square feet that has water and electricity in it. And the third option, which I think we're gonna wanna look into, would be for us to erect our own building. And I think that's something that's a possibility that I'm gonna have the management committee, when they meet tomorrow, to put on their docket to look into. The location that we're looking at for that would be over by the shed that Chris Drake uses over by the jail. And we could add on to that, but a separate part and so forth, so. We have to get more information about all that before we can really make a decision on which of those three we need to go. But I want everybody to be aware of this. I want everybody to be thinking of you know, how we can all facilitate and get this program back on the solid footing. Because there's a problem right now. I guess Dee has got another example of a situation that comes up, and these situations will continue to come up. The one thing that we do have in place, which I think I mentioned last month as far as rabies cases, was some abilities to go up to Kankakee Animal Control or Ford County Animal Control and get some assistance there. But it's not an ideal situation. The other thing that I've done, the Animal Control Act says specifically that the administrator, excuse me, preferably would be a veterinarian, but it doesn't have to be. And so I've appointed Jill Johnson temporarily to fill that role. She's graciously agreed to do it.
Watch it again.
Obviously, it's something that we need to try and get resolved as soon as possible, but I've been told there's a shortage in the state of Illinois of about 200 vets. So where do you find one? Veterinarians that are graduating from the schools do not want to come to Illinois because it's not a very favorable business climate. If they're going to start their own practice, they're going to go to another state where they can make more money and have a more favorable situation. So I'm sure that contributes greatly to the problem that exists here in Illinois. But until we can get a veterinarian to want to participate, we're gonna be handicapped. All I can say is that everybody needs to try and cooperate as much as they can and be patient as we're trying to get this thing figured out and get something in place that we can get the situation going properly. So that's kind of it in a nutshell. If anybody have any questions, I'd be happy to try and answer them.
We know you're trying.
I guess that's it.
Thanks, John.
And,
Go ahead.
Dr. Yusuf set a price on his building?
Yes.
Then find out later, I guess.
Well, I can tell you, it's listed as real estate in town for $199,000.
It's an old building.
He's told me privately that he would sell it to the county for $120,000. I think the problem was twofold. One is it's located in the floodplain.
Yes.
And while it, so far as my understanding, it's never had any water come into it. But whenever we have a flood, it's isolated completely, cut off from any access, and that's a problem. To me, it would be a bad investment on our part if we were to purchase the building and you know, what are we going to do with it? If we get to the point where we want to build something that's more modern or more up to date, what are we going to do? Who's going to buy it? That's why nobody wants to buy it now. And I talked to the real estate lady that's listing the property. I tried to encourage her to get the listing on some of these different colleges have placement services that they offer to their, not only to their graduates, but to their alumni, but also the people that are going to graduate. And their response is, well, I don't want to do that. All I want to do is sell the building. To me, that's a very poor attitude, but I mean, I can't force them to do something. It's not our building. We can't sell the building. They need to sell the building. They need to try and do something. You know, if they want to have another vet come, they need to be the ones that are going to actively pursue that, I think, more so than the county. And the real estate lady that's got it, she's trying to promote it as a facility for dog grooming. Nothing about any of that. But, you know, I think the price will keep coming down until finally somebody does buy it.
Yes.
But I don't know, from our standpoint, what number would you think we should pay for someplace that's like that?
I think a year from now, I think things will be a lot cheaper, but what do we do in the meantime, you know? Well, I would say somewhere under at least 100,000.
I mean, right now, we need to find a place to house the animals that are picked up. You know, I mean, that, even though the arrangements we have for rabies cases are not ideal, at least it's something we can struggle through, but we don't have any place to house any animals when they're picked up, dogs or cats or what have you. I don't know all the people I've talked to about it, people that I think know this area pretty well.
So all we really need are some, you know, like, we don't need any office spaces or anything, or we just need some
Well, I mean,
cages.
ideally, ideally the place would have an office for the wardens to keep their records, to take care of their paperwork and that sort of thing. If push came to shove, they can come here and probably do most of that at the finance center, I guess, but
Yeah.
They have to do
ideally
that.
there'd be a place at that location where they could do that. But other than that, I mean, the ideal situation is to have a veterinarian that's in charge of that, which falls in line with the state's Animal Control Act and has the responsibility as well as the expertise to administer if any animals are injured or sick or need shots. These are all things that happen, you know, apart from rabies cases. So, I mean, those kinds of situations exist, and right now we don't have any answer for them. I had one instance where the police chief down in Milford contacted me about a dog down there that was like apparently been harassing some people. And the only advice I could give him was, you're a peace officer and you have a weapon. And if that dog is threatening somebody's life, you may find it necessary to do that. I said, I don't know what else I can tell you. You can't just stand by idly and let a dog attack a human being. And we don't have any ability to take the animal away. So, you know, I mean, that situation was resolved. I think the animal was back with its owner and under control. But those kinds of situations can exist. They have existed in the past. You never know when they're going to happen. Usually more in the summertime than any other time of the year. But still, you know, we need to be prepared to handle those kinds of things.
Oh, well, obviously I'm concerned about the safety of the community, but right now, as far as the health department goes, if we don't have a veterinarian that can process the animal who's available, right now Dr. Updike agreed to that on Friday, bless his heart, but we don't have a veterinarian that will euthanize an animal to be tested. So if you have an animal and there's no place to quarantine the animal, no record of vaccination against rabies, no vet to process a specimen so that we can send it to the state lab to be tested, then the only option that the health department the only option that leaves us with is to recommend the rabies prophylaxis series for people, and that costs like $20,000. Some insurance companies will cover it and some won't. That's a huge expense. The rabies PEP multi-dose vaccine costs over 20 grand. And that's a lot for people because we can't find a vet.
It's not pleasant either.
No, because that vaccine has side effects.
The one issue that I was talking to is finding a place where we can take animals that are not involved with rabies. But the issue that you're talking about, I did talk with Dr. Updike about 2 weeks ago, and he agreed that he would help us in that respect.
Yeah, and he was very gracious and did help us.
And the people up in Kankakee County have made the same agreement. Jill has been
Is this a temporary agreement though? I mean, okay.
So, I mean, we have those bases covered, not really the way we'd like, but right now it's the best we can do.
So you talked to Dr. Joe or that one there in Gilman?
The one in Gilman I've not been able to talk to. You call over there and don't get any response. I went over there one time, all the doors are locked. Sign on the door says call the number, so you call the number, and I mean, they don't even look like anybody's there.
Yeah, she's got odd hours.
But I did talk to her one time on the telephone. Said, how come I'm having all this trouble getting a hold of you? How can I rectify this? She said, well, now that I know you, it won't be any issue. Well, I've called her since then, and it's still the same problem. We just.
Yeah, you gotta be able to get a hold of them.
She told me point blank she did not want to do any of it. So, I mean, that just kind of leaves us between a rock and a hard place. As far as she's concerned.
Any more questions for John? Go ahead.
Not John, but this is on the
Animal control?
animal control type thing, all the investigations and that. And I'm quite familiar with this one because it's right across the street from me, and investigated a reported at-large ticket. This is the third time that has happened.
What's happened? You have to
The
refresh
dog's
me.
been at large, and In fact, there's 2 dogs there. And the first time why they went over to the next door to the neighbor, and she's got a little Yorkshire Terrier, and they jumped on her, and then the second time why the people were bringing them out, and they didn't have a leash on them, holding them just by the collar, and they got away and ran over to their yard. And this last time why they had them out and they weren't on a leash. And these are young people, and they shouldn't even have animals, and they're ticked off at the neighbor because they're reporting them. Like I say, this is the 3rd time, so what do they do after the 3rd time? What's the procedure?
There's not a whole lot they can do at this point. We don't have.
What's that, Jim?
There's not a whole lot to do at this point, just because we can't take in any dogs. So if they were to give them the option to relinquish them or seize them, we don't have anywhere to take them. So as far as Linda's concerned, all she can do is ticket them.
And this is the 3rd time they've received a ticket.
Mm-hmm.
Have they paid it?
They would pay over at the courthouse. I'm not sure.
But it's ongoing and it'll keep happening. That's the type of people they are.
Till something bad happens, but what can we
Yeah,
do about it right
So
now?
they jump on the dog and kill it, or they attack Bonnie because she's trying to protect her dog. And
Unfortunately, we have no animal control that can do anything right now.
John, if the county forked over the money to build a place, is it a moneymaker?
Well, that's a good question, and it's a difficult question to answer because we've never owned the facility. We do have in our budget amount of money that's paid out monthly or has been paid monthly for the use of this facility. So that rent or that money can be looked at as, something. If you build your own, you don't have that expense anymore.
Sure.
You do have the expense of your facility, electric and light and all that, but whether that would be a wash or not is hard to say. Might depend on how much of it is augmented by, animals that are brought in and fees that are collected for housing them, for room and board and all that sort of
And
thing.
who sets the fees? Could we raise the fees in order to pay for the building?
I guess so, up to a point. But it's also something that I think I've talked to Joe about, and we haven't completely determined yet whether something like that, the cost of something like that would be covered by these ARPA funds. That's a possibility. Part of it depends on how much you might be able to say that Dr. Youssef resigning might be attributed to the virus and the fact that his business declined significantly because of that.
You have to prove it though.
But that's a hurdle we haven't completely cleared yet, so.
how about the money that we paid him? I think it's $15,000 a year. Could you draw from that to help offset expenses at the beginning, or would that be feasible or possible under law?
It isn't a matter of whether it's feasible or not. It's a matter of if, that money is targeted for a specific purpose of having an administrator. So we need to have an administrator, so it's gonna have to go for that ultimately.
Yeah.
I mean, temporarily, until we get an administrator, or it may not all be used for that purpose, but I mean, there's other ramifications to your question.
Yeah, that's what I was wondering, yeah.
But every penny that's in the animal control budget is available for however we choose to use it.
Yeah.
At the moment.
Right.
And so it's gonna be a question of what decisions are made here going forward. So I think, obviously we wanna try and make some decisions here as soon as we can, but I don't wanna be hasty about it and do something that we regret.
Yeah,
That's part of the reason why I said I'm right at this point not in favor of buying the building that's out there.
yeah.
But if the board wants to buy the building,
Yeah,
we'll buy the building. I mean, I can be overruled pretty easily on that, but my advice is not to do that, and I haven't talked to anybody yet that says we should buy it. But we're gonna have to do something. Unfortunately.
yeah.
Anybody else have any more questions? Okay, we'll move on to, thank you, John. We'll move on to discussion and action on a request to participate in the U of I Feral Cat Day. And Linda has 6 cats, and I'm gonna hand this over to Jill to talk about it.
Our animal control warden, Linda, was contacted by a citizen that has 6 feral cats that she would like to get spayed or neutered. And the University of Illinois holds a feral cat day, and I don't remember, I gave the paperwork to John, but it's someday in September, the end of September. And they are holding 6 spots for her, but they require that the county animal control administrator or a vet sign off that these are feral cats and they're not house cats, because they're trying to just control the feral population. And so she has requested that we allow her to participate in this feral cat day, and if it is approved, then we would need to have these applications, which I gave to John, signed. And Linda did verify that they are feral cats. It's no cost to us. It's just we have to sign off that they were feral.
Any questions for Jill?
Yeah, how do you catch feral cats?
I'm not sure how she caught them. I don't know if she trapped them. I don't know.
You put cat food in a trap.
I guess that's the question on that. Is she gonna release it back to the wild after they get neutered?
Mm-hmm. As far as I know, that's the plan.
Okay. Is there anything that we have to do in this committee for?
You would just have to, if you want to approve the request,
Have a
'cause
motion.
I would need John to sign off on those.
I'll make a motion.
Mm-hmm.
Somebody want
I'll make a motion to approve the feral cat day.
a second?
I'll second.
All in favor, say aye.
Aye.
Opposed? Motion carried. Thank you, Jill. All right, now it's time for D. Shepherd with the Iroquois County Public Health
Take one down and pass them around. I'll give Jill one too.
Got 5 minutes.
Thank you for all you're doing. Bless your heart.
5 minutes.
It's everybody's dream to be the animal control warden, isn't it? Poor girl. You're doing the best you can, and I think we couldn't ask for better, so. Okay, did John get one of these?
Yeah.
Okay, thanks. So that's just our summary report of programs. First of all, good morning.
Good morning.
So I wanted to fill you in a little bit on a few things before I kind of go into COVID stuff. With regards to the health department, we do have a new grant. We have an emergency senior services grant that is available to anyone, any resident of Iroquois County who's age 60 or older. There are no income eligibility requirements, so this is something different than our CCU program. This is a grant that I applied for and we received through the Department of Aging to help our citizens who are 60 and older with purchasing things like groceries, medications, medical supplies like a wheelchair, a cane, a walker, a grab bar for a shower, things that will help people remain in their home and out of a long-term care facility. A lot of our residents in the county really are on strapped incomes, and some of them have to decide every month whether they're going to buy their groceries or their medicine. So this grant will help those people who are making those difficult choices. So if you know of anyone in need, just refer them to our health department. And we have grant money available to help them, and we'd be happy to do that. Thank you, Taylor. So we would, we want to spread the word about that. We put out a press release to all the local, to over 125 different entities, and we put it on Facebook and it's on our website. But we also I wanted to make sure that our county board members knew that, because I do know that sometimes people reach out to you guys for assistance. And this grant will go on as long as we have funds available to expend to them through the end of the year. Okay, actually, not through the end of the year, through the end of the fiscal year. So not the calendar year. The fiscal year for that grant will go through at least the end of next June. Okay? We are told that if we expend it, there's already language in the grant written that we will receive the same amount for a second year. So we want to make sure that we're helping Iroquois County residents.
Very good.
Then, as far as the summary report of programs, there isn't a lot on there that is different. You can see that the number of food sanitation inspections really increased in August. In July we had 28, and in August we had 43. We're back to doing more of that because you can see that we issued less temporary food permits. A lot of the summer stuff is winding down for the temporary food permits, although we still did 9 of them in August. We did 16 water sample kits. You can see there are so many things on the list. We try not to list them too long. Poor Amanda be typing, or whoever types the notes up for the report would be typing for pages and pages and pages. But this environmental part goes through food sanitation, water samples, wells, private sewage disposal, solid waste, West Nile virus, tobacco, radon, complaints, tanning inspections, body art. You can see that under community health, the immunizations increased a lot for childhood immunizations. That's because kids need their back to school immunizations. The immunizations that are required in the state of Illinois for a child to attend a public school have a deadline of October 15th. So the September numbers will go up again, and so will the October numbers. And then after that, they'll drop down to regular numbers.
School bus out there, are they getting immunized?
They could be. It's very possible, yes. We do a lot of immunizations in the late summer and early fall because of the school requirements. You can see that we had 3 animal bites so far that happened in August. Now this last one that we were just talking about was a September one, so it's not on there obviously, but of those 3 animal bites, those 3 were dogs and all 3 were quarantined. Most of the quarantines right now are going to be household quarantines, where we're requiring that they keep the dog at least for 10 days. And once in a while, we'll have somebody that their animal bites, they've gotten a new animal or something and their animal bites a family member, and they want that dog gone. They don't want that dog anymore, but we tell them that in order for the person not to have to go through the rabies prophylaxis, that dog needs to be alive for 10 days and then examined for rabies at the end of that 10-day period. So most people are cooperative when they realize what that entails for the bite victim. Not always, but most of the time. Any questions about any of our other things? You can see that we had 5 hepatitis C cases. Some of them were not a case. Some of those people ended up being HCV or RNA negative. Do you have a question, John? Yeah.
Yep, on the West Nile,
Yes.
you said you got 1 bird,
Yes, we had 1 bird in Iroquois County test positive.
but no mosquitoes.
No mosquito samples have tested positive. And we collect those every day. And and we will continue to do that through the end of September. Right now, the bird that tested positive came from the Gilman area. So we know that it's very possible that the mosquitoes around the Gilman area also could carry West Nile virus. So we did a press release, as soon as that happened, letting the public know, and I heard several of the local radio stations talking about it to let people know. And then we went through mosquito mitigation efforts, the appropriate spray, and not leaving standing water in your yard, and avoiding going out, with short sleeves at dusk and at dawn when the mosquitoes are the worst, and so forth. Yeah.
Is it one of your sample stations from the mosquitoes south of Gilman or where?
Yes, we have one in the Gilman area, yes. So we're definitely monitoring that. And that bird could have flown from anywhere. We don't know, but
Yeah, we're
That kind
starting
of
to get
stu-
into the time of year when the birds are migrating.
yeah, definitely. We had investigated 3 Lyme disease cases this month. 2 of them ended up not being a case, but we did have one positive. That individual had traveled to northern Wisconsin, where we think that they acquired Lyme disease. That's really all that's, hugely outstanding. That's different than what we usually see. So if you have any questions about that, you can contact me later too. In the meantime, very quickly, we'll talk about just what's going on new with COVID. So you can see that our case numbers are up to 3,757 total cases. That's 3,131 confirmed cases and 626 probable cases. The probable cases are those who've tested positive using a rapid test that's not IDPH approved. Of those 3,757 cases, 3,460 have been released. We currently have on home isolation 217 people. Now, that's 217 people who are on isolation, not quarantine. That's 217 people who have tested positive. Can you imagine how many of their direct contacts are quarantined? Thousands. We currently have, as of today, 13 in the hospital, and we have 67 people who have died with COVID. And remember, I would say with COVID, not of COVID, because if they die within the 10 days that they're in isolation, then we count them as a case. If they die on day 11 or 12, I don't count them. Okay? So it depends on what your perspective is on that. But we did have another death recently. Right now, I'm going to give you some Iroquois County statistics that can be found through the IDPH website, but we don't usually share on ours. Right now, that's the wrong one. Approximately 38.37% of Iroquois County is fully vaccinated, meaning that they have completed their either both doses of a 2-dose regimen or have taken the 1-dose Johnson & Johnson. 38.37% of the population is fully vaccinated. That means that we have vaccinated 10,593 people. According to IDPH, the population of Iroquois County is 27,604. Now, if you look at the U.S. Census Bureau, it has our population at 27,000. I think it's 117. But for all health department purposes, we usually use the population that is being used by IDPH as well. So with that being said, we can break the vaccines down. That's not what I sort of print. Okay, I didn't bring my phone with me. I'll never remember it, so I won't quote those. I had it broken down by age groups. I sent it to Taylor this morning and left my phone there because she was printing it for me, but it didn't print out. Did not print out. Yeah, that's unfortunate. So I didn't bring my phone. I won't quote them. But you can go to the IDPH website and look that up too. So we're still hoping that more and more people become vaccinated. Yes.
Okay, what is the status of the booster shots?
Okay, so right now, the health department is giving third doses. They're not considered a booster. Third doses to those who are immunocompromised. So if someone has a diagnosis from a physician, any kind of diagnosis that indicates that they are immunocompromised, and what we tell people is to check with their doctor to see. There's a list of those conditions on the link on our website that people can look those conditions up. But I have instructed the health department at Iroquois County Public Health Department not to ask people what their conditions are. If they sign an attestation saying that they have one of the following things listed by the CDC and IDPH as a condition, and they sign the attestation, we're not to question them. It's not our business what someone has, what disease someone has, as long as it's not communicable and contagious to other people. They're not asking individuals what their immunocompromised disease is. If that person signs the attestation, we will provide them with a third dose. As far as booster doses for the general population, we don't have any kind of standing orders or any kind of ACIP recommendation, written documentation from the state yet. And once we do that, then we'll let you know that we will. We'll put out a press release and we'll put it on our website and our Facebook page and all the local radio stations, newspapers. Yeah.
The protocol I've heard is 8 months since your last shot.
That's what they're considering.
What's the difference between the third shot and the booster? Is that the same thing?
No, they're not the same thing.
So what's...
the dosage is the same, but they're not considered the same thing. A third dose in a primary series is to make sure that those immunocompromised individuals have enough antibodies. For example, I'm gonna use my mom for an example, because she was not gonna sue me, okay? So my mom takes daily chemo. So my mom would qualify because we know her chemotherapy also destroys healthy cells and it also destroys her antibody level. I'm gonna wanna get her a third dose when she's agreeable to get a third dose. So that's just to boost her antibody level, okay? That is considered part of the primary series for immunocompromised people, this third dose. People who don't have any immune system problems or are not taking a medication or treatments that weaken their immune system, they only need 2 doses for the primary series, okay? The booster shot, which will come later for individuals, which I was listening to what I consider a reliable source yesterday, and they thought maybe even by as early as in the next couple of weeks that we'll be giving standard third boosters to people. But we don't have any documentation or, like I said, ACIP standing orders, and we'll follow standing orders when we get them. So when that happens, we'll let people know when boosters are available.
So the booster is for
Anybody.
anybody.
Mm-hmm.
So let's say someone that's, as you said, needs the third dose. Are they able to get the booster then?
We don't know that yet.
So how many more shots are
I don't know. I don't know how to answer that. As soon as I know, I'll let you know.
So will the booster shot have to be from the same company that you got your?
Yes.
Yes.
at least everything that we've been told so far is you want to stay with your same manufacturer.
Okay.
So the third shot is available now, is what
The
you're saying?
third shot is available now for immunocompromised individuals. And they can just call the health department and make an appointment. It's that simple. And we're giving shots Monday through Friday from 9 a.m. until 3:30 p.m. We will take appointments. We won't turn people away, but we much prefer our clinics be by appointment so that we can socially distance people and so we don't have people lined up in the hallways. You guys notice that, there's been a lot of talk lately about how, the health department lined people up in this main hallway for shots. That's not true. Never once have we lined up people in this main hallway for shots. First of all, the health department has a separate entrance. We built a door separating us from the main entrance from the other county offices. And when we have people come in for immunization appointments, we make sure that we schedule them. But people do come early and come late, but if they do, then we ask them if we see that we are not able to socially distance people 6 feet apart, then we ask them to sit outside if the weather's nice, or we ask them to remain in their cars if the weather's not so nice. And people who are coming for their shots have been very cooperative with that. So we're taking all precautions that we can to make sure that we don't have an outbreak associated with with vaccinating people. And so far, we have never had any cases that I'm aware of that are associated with any vaccine clinics anywhere in the county. I think everybody who's doing them, all the entities, are doing a good job. We've not been able to contact trace them back to a vaccine clinic. Yeah.
So this third shot and the booster now, is that going to help with any strain that's new coming, or?
We don't know. What we do know is that, regardless of what you read on social media or on Facebook, please pay so little attention to that stuff. It's just, I look at it every day, and I've even had family members that have said to me, well, that makes sense. No, here's why it doesn't make sense. You have to spend time explaining to them. The problem with all this social media is there's so much disinformation out there. There really is a lot of disinformation. What was your original question again, Barb? I kind of got sidetracked there.
About the strains?
About the strains. Okay, so what we know is this. We know that the Delta strain is much stronger than the Alpha or Gamma variants of COVID-19 that we have seen so far. We know that Delta tends to make people sicker with more signs and symptoms of illness. We know that the Delta variant is much more contagious because those people carry a viral load that is significantly higher than people who have had COVID of an Alpha or Gamma Delta or an Alpha or Gamma variant. The Delta variant, people who have Delta variant have a much higher viral load, so they spread it to more people. So we know that. I can tell you that we are seeing people who are vaccinated that have breakthrough cases. We see breakthrough cases, but those people do tend to not be near as sick as the unvaccinated. Most of the hospitalizations, and we've had some people who have had breakthrough cases who have had to be hospitalized, but most of the hospitalizations and the people who are severely ill are the unvaccinated. That's exactly what we see. So anyone that thinks that the vaccines don't work they don't know what they're talking about. They really do not know what they're talking about.
So let's say if someone has had 2 of the shots and they get this Delta without having the third shot, are you still protected in a way?
Yeah, so
Against
it's kind
Delta?
of like this. It's the same principle as the flu shots every year. Every year the flu shots are different because they have different strains in them. It may not prevent you from getting the flu, but it will definitely lessen the symptoms if you get the flu. Same thing with is happening as we're going to see more and more mutated strains of COVID, and it's going to continue to mutate, and it's going to continue. We're going to see strains that are stronger and stronger. Unfortunately, viruses do one of two things as they pass from person to person. They either get weaker or they get stronger. This one happens to be getting stronger, which is unfortunate because we were hoping that it wouldn't. You know, our hopes, you know, over the last year was that we wouldn't see this, but we are seeing it, and the vaccine does protect people from those severe breakthrough cases where people end up, you know. I haven't had it so far, to my knowledge, no one in Iroquois County has died that was fully vaccinated.
Any questions or continue on?
Any other COVID stuff? I'm sure you're COVID talked out. I do this day and night from 6 in the morning till 11 at night every day. I have for you our annual report. We're unable, this is the 2020 annual report, and here we are in September of 2021. I can't complete these until after, you know, as you know, Iroquois County functions on a 6-month accrual basis. So until we have to wait for at least 6 months to do any of the financial reporting. So these went to the Board of Health in July to be looked at and then approved in August. So, so here's our 2020 annual report, and I have a copy here for everyone if you'd like to take one and pass them around.
Yeah.
I'll give one to Jill here. Tells you all about our services, and I think if people are surprised when they look at these, at the huge array of services that the health department offers. I think people are always shocked that we have so many programs. Thanks. Right next to there? Okay. And if you have any questions about anything you see in the annual report, feel free to give me a call. I'll answer any questions you have. Yeah.
When it comes to COVID and Delta, you can tell the difference, the different strains.
No, I can't.
No, I can't, but I mean, can they? Yeah.
Well, yeah, so here's what happens. So when a specimen is sent to the Illinois Department of Public Health laboratory or to any other reference laboratory, they can genotype those strains.
Yeah.
Okay, those strains then are genotyped. Okay, they use genomic sequencing to tell us what strain it is. Not all specimens are genotyped. Iroquois County Public Health Department has no control over which specimens that the lab genotypes. We don't find out the genotyping at the same time we do a positive or negative test. So that comes up like a week or so later. But then they do report out to us the ones that they have genotyped and what strains they are, and by far worse being Delta. That's our prevalent one right now.
Right.
That's why our caseload's so high.
Is there another one on its way?
Yeah,
What's
Lambda's coming,
the which one?
Lambda, and there's a new one called MU that's coming. Yeah,
So we're ever gonna see an end of this?
don't know.
Come on, why don't you?
Don't have a crystal
We
ball.
haven't seen it in the smallpox yet,
You
or tuberculosis.
know, we do. Speaking of tuberculosis, you did see that, right? We do have an active case in Iroquois County now. We are mitigating it.
Or polio, or any of these other places.
And the person that we're mitigating it has been very cooperative, so we've been very fortunate.
Any questions for Dee? Is that it on your report, or do you have more?
And I mean, I can take any questions you have, but that's all I.
All right. Do we have any old business today? New business? I have a motion to adjourn. Roger, second. All in favor, say aye.
Aye.
Opposed? Meeting adjourned.
Thank you.